Hi, I'm Colleen, a family nurse practitioner and owner of Serene Primary Care. Welcome back to our Menopause Mondays. Today we're going to be talking about treatment of vasomotor symptoms without using hormones. Hormone therapy isn't the right choice for everyone. Some women are not candidates because of medical reasons, while others prefer to treat without hormones. The good news is we have plenty of options to treat our vasomotor symptoms like hot flashes and night sweats without hormones. Let's talk about some options. We'll start with SSRIs and SNRIs. SSRIs are medications like paroxetine, as well as SNRIs, which are medications like venlafaxine. These medications are typically used for depression and for anxiety. The doses, however, are different. To get a response for your vasomotor symptoms, you need lower doses of the medication than you would need if you were treating for depression or anxiety. The good news about lower doses is it tends to come with fewer side effects. That means there's minimal impact on weight as well as your sexual desire or ability to achieve orgasm. The other benefit is how quickly these medications tend to start working. For your vasomotor symptoms like hot flashes and night sweats, you'll often see improvement within a week of starting the medication, unlike when we're treating for depression or anxiety, which may take longer, typically up to 6 weeks. Some side effects are going to resolve as your body adjusts to the medication. These are typically related to the GI effects like nausea. So what if you've tried an SSRI or an SNRI and have no benefit, or you have too many side effects to really make continuing on the medication worthwhile? The good news is we have further options that you can choose from. Another medication that is commonly used for vasomotor symptoms is gabapentin. Now the dosing for gabapentin and your vasomotor symptoms is quite high. It's in the 900 to 2400 milligrams per day dosing range. And gabapentin does come with side effects. So one of the strategies is to start really low, and typically at night, because the medication will cause some drowsiness for most people. And as you tolerate that medication, we can increase the dose as needed for your vasomotor symptoms. The other benefit of gabapentin is it is cleared through your kidneys, which means it doesn't interact with other medications that are going to be cleared through your liver. A common interaction with our medications for menopause is tamoxifen, which is what we're using for women who've had cancers. Oxybutynin is another medication that I've used to help with hot flashes and sweatings. It is an anticholinergic, which basically means it's going to stop everything in that system of the body. So less sweating, but also potentially constipation or difficulty urinating. It can also cross the blood-brain barrier, so it may exacerbate some of those brain fog or difficulty concentrating symptoms for some women. Fezolinetant is a new medication FDA-approved for your vasomotor symptoms. It targets the area in the brain that controls our temperature, therefore calming the intensity and the frequency of hot flashes and night sweats or any other vasomotor symptoms that women are experiencing. With this new medication, it is important to monitor your liver functions fairly regularly, especially as you start the medication. So with all these choices, how do we know whether or not the medication is working? One way is to simply keep track of your hot flashes and your night sweats or any other vasomotor symptom you may have. I often will recommend to patients that they keep track of their symptoms before they go in to see their provider, as well as after any changes are made. That way we have a baseline of where we're starting and we know whether or not we've made improvement. One of the tricks is to put 10 dimes into one pocket, and every time you have a hot flash or a sweat or any other vasomotor symptom, you simply move that dime to the other side. There's also apps that you can use on your phone to keep track, and then we monitor over time whether or not you're having a benefit on the medication specifically for those vasomotor symptoms. There is also a scale available that measures how your vasomotor symptoms are impacting your sleep, your mood, and your concentration. It's also exciting to know that we have non-pharmacological treatments as well. So these are treatments that don't require any medication. For some women, we do layer these non-pharmacological treatments with their medications in order to get an even better treatment result. Cognitive behavioral therapy, specifically for menopause and vasomotor symptoms, does improve women's experience of their vasomotor symptoms. Clinical hypnosis is also used to decrease the vasomotor symptoms, and there is even an app that is available now that will provide guided sessions for women. It's important to know that this is not a one and done approach. Symptoms related to menopause can last 5 to 8 years, and it often takes tweaking and adjusting to fine-tune the right combination of treatment that relieves a woman's symptoms. I encourage regular check-ins with your provider about every 6 to 12 weeks to make sure you're on the right track. Stick with it and know you don't have to navigate this alone. Thanks for watching, and I'll see you on the next one.